Program coordinators in a CDC-recognized lifestyle change program play many roles. These roles include overseeing daily operations, supporting and guiding lifestyle coaches, and making sure the program meets the quality performance standards of the Diabetes Prevention Recognition Program, or DPRP. In this video, one of a 4-part series, Program Coordinator Miriam Bell explains her roles and responsibilities.
I think that my most important role is really helping to keep the team motivated. There are a lot of moving parts to it. There is a huge data element part. There is a huge logistical part. There is a huge training component to it as well. And so it's just really important to understand all of those different pieces and explain to people the importance of their role. And I think when people understand what their role is, that helps keep their motivation intact, and then that translates into motivation, that their enthusiasm then gets transmitted or communicated to the participants in the class.
To help your staff members fully understand their roles, make sure they have read the DPRP standards and operating procedures. The DPRP standards outline the quality performance measures for delivering the Lifestyle Change program and provide essential information about the requirements for CDC recognition. They explain the application and data submission procedures and provide information about staff eligibility, roles, and responsibilities.
It is important for all of the staff to understand what the DPRP standards are, because the DPRP standards cover a wide range of topics. And so we have different staff that are responsible for different aspects of the program. And so they're going to need to know what those standards are so that they understand what their responsibilities are. But I think most importantly for our lifestyle coaches, we really want them to be very well versed and have a good understanding of what those requirements are, so that as they are out in the field working with the members, that they can reinforce with the members why it's so important for them to come every single week for 16 weeks. And then once we taper off to every other week during the month 7 through 12, why it's so important for them to continue to have that connection going forward.
Program coordinators must work with their organization to find the best ways to offer the Lifestyle Change program with integrity. Sessions can be offered more frequently than the minimum requirements of 16 weekly sessions in the first 6 months and 6 monthly sessions in the second 6 months. Offering bi-weekly sessions after the first 6 months as a means to help participants transition from weekly to monthly sessions can be a very effective tool in keeping participants engaged while also helping your organization achieve attendance goals. While achieving recognition is important to you as the program coordinator, always keep in mind the important role of attendance in helping participants meet their individual weight loss goals. Offering more than the minimum required sessions in the standards could boost participant success.
So we balance organizational needs with the DPRP requirements, again, by having that leadership support. So, we've been given, or I have been given, the responsibility to make sure that that this program is implemented properly and implemented in a manner in which it will be successful. And so the way that you make sure that it's successful is by looking at what the different requirements are and really putting systems in place that can help you achieve it.
Program coordinators play a critical role in monitoring participant data. By reviewing participant data on an ongoing basis, you can make sure that participants are progressing toward their goals. Continuous monitoring will also help you to identify the areas of your program that require improvement and tailor training and technical assistance for lifestyle coaches. Dashboards and summary sheets can provide your team with helpful progress details. Review program data regularly with your lifestyle coaches and other relevant staff members, and strategize ways to improve participant performance and program success. It also helps to appoint a staff member to help you conduct quality assurance.
You have to make sure that the information that is collected is thorough and complete. And so you really have to stay on top of that, because if you wait, it can become a little bit overwhelming. So you want to make sure that people understand what their responsibilities are. The same as for the analysts. You want to work with your analysts and have your analysts provide you with the deadline of, okay, if this is what the information is that you need to provide to the CDC by this particular date, what is the analyst's deadline for me to get all of that data to them?
As Miriam mentioned, CDC has very specific data collection requirements which can be found in the current version of the DPRP standards. To make sure your organization submits data correctly and on time, you need to communicate and interact with your staff on a regular basis and, if needed, contact the DPRP for technical assistance. In addition to communicating with your staff, you also need to communicate frequently with your key stakeholders and partners. The number and type of stakeholders and partners will vary based on the size and type of organization. Larger organizations, such as Miriam's, might require more staff to maintain daily operations and more partners with whom you would discuss program progress. No matter what your organization's size, it's most important to assure that you have the capacity to deliver a lifestyle change program, including employing enough trained lifestyle coaches to accommodate the number of participants you have enrolled. Having someone skilled who can collect and submit program data to CDC is also important. Depending on the number of participants you have enrolled, you might find it helpful to employ a designated staff member to support data entry and submission to CDC. The more participants you have, the more data you'll have. Miriam's program is a good example of an organization with lots of data due to high participant enrollment.
My key stakeholders are my boss. So we have a quality department, so our VP of quality is kept very up to date on what's going on with the diabetes prevention program. I have a physician partner who helps get messages out to the medical staff about what's going on with the DPP and to encourage participation. I also have our manager of nutrition services who really is critical in ensuring that the lifestyle coaches are trained. I also have an analyst. Our analyst plays a really big role. We are collecting just mountains and mountains of data, and so we have to get that information to the analyst and make sure that it is compiled properly so that it can be uploaded to the CDC for evaluation. And also our manager of health education, our coordinator of health education, who just handles the logistics of ensuring that these classes go off without a hitch.
Supporting lifestyle coaches is one of the most important roles for a program coordinator. Research has shown that fully trained and committed lifestyle coaches have the most significant impact on participant success. Offer them guidance on program delivery, data collection, and quality assurance. Encourage them to participate in CDC webinars, calls, and meetings. Promote interactions with other lifestyle coaches. Also make sure you provide them with continual feedback so they can adjust their approach to achieve more successful outcomes. New lifestyle coaches, or those who want more training, may benefit from being mentored by a more experienced lifestyle coach or master trainer, or both.
Our master trainer has implemented a mentorship program. So she trains additional lifestyle coaches. And so for people who are newly trained, she pairs them up with people who have been teaching the DPP for a year or more. They're out in the field, teaching the DPP, but they also teach a lot of other classes, a lot of other healthy living classes for us. So it's an opportunity to bring those who are specializing in teaching the diabetes prevention program together, just to share best practices and to share information. And one person on our staff is a master trainer. And so she communicates with them on a bi-weekly basis. So we're using a tool called Outlook Groups, which allows them to exchange information on their mobile devices. And so she is able to post information every other week for them, whether it's motivational information or just information about the DPP. information about the latest and greatest regarding nutrition or physical activity, and they're able to have a conversation going that way in real time. So we do try to create a lot of different opportunities for them to interact and to receive additional training.
Help lifestyle coaches become more effective by encouraging them to connect with and support their participants.
I think the way that we keep the lifestyle coaches motivated is they meet with the participants. They become a really important part of the participants' lives. They get to know folks' life story, folks' challenges, just seeing the improvement, the incremental improvements, the incremental changes week after week after week. That alone is really motivating for the lifestyle coaches because they can really see the direct result of their hard work, and so that's really motivating. And then some people participate and it just may feel like they're not making any improvements, but they have to encourage members to maintain their commitment to the program, and over time you definitely can see an improvement. So just that connection, that human connection, is just really motivating for the lifestyle coaches.
Motivation is critical for you, for your staff, and for the participants. The greatest motivator of all is seeing the impact the Lifestyle Change program makes in your participants' lives.
No matter what the size of your organization, just know that whatever work you put into it can really have a profound impact on someone's life. So whatever you're able to do, whether you're able to only hire one lifestyle coach or whether you are able to hire a whole cadre of lifestyle coaches, really start where you are and do what you can to adhere to the CDC's requirements. And even if you're only able to help one or two people, it's really worth it.
With 84.1 million Americans with prediabetes, it's important to reach as many people as possible. And as you've heard, program coordinators play many key roles in successfully implementing the National DPP Lifestyle Change Program. You are critically important in ensuring that organizations follow the DPRP standards. You also are responsible for guiding lifestyle coaches and helping the coaches support participants. To learn more about being a program coordinator, watch the rest of the video series and visit CDC's National DPP website. If you have any questions, just send an email to dprpask@cdc.gov.